Good evening to you. PEPFAR is planning to collaborate with prominent South Africans like Nomzamo Mbatha in an effort to educate the public about the importance of and urgent need to reach HIV epidemic control in South Africa. Nomzamo Mbatha is a passionate activist and actress who's already a considerable advocate on HIV issues, and her voice is valuable in sharing this message. PEPFAR is committed to ensuring that the effects of the COVID-19 pandemic do not erase the hard-fought progress that South Africa has made over many years in the HIV response. US Ambassador to South Africa, Lana Marks, joins us now alongside SA actress and UNHCR Goodwill Ambassador Nomzamo Mbatha. Both are on Skype. A very good evening to you both, and thank you so much for speaking to us.
Great honor.
Great to be here.
Nomzamo.
So, Ambassador, let me just start with you. The importance of this at this time. We have spoken before and with other stakeholders on many occasions how COVID-19 is taking away much needed resources from very serious pandemics, from very illnesses, and even causing higher levels of hunger, food insecurity, poverty. So what is important about this particular PEPFAR program is that how will it combat some of these challenges?
Yes, this is a 9.4 billion program over many years. And we have a tremendous infrastructure together with the South African Ministry of Health, and because of that we've been able to pivot to assist in many areas of COVID-19. However, we don't want to lose sight of the goal. Congress has been enormously generous, donating an extra $1.5 million US over the next 2 years up until the end of this year, and we really do need to reach epidemic control in South Africa, which is the most important country in the world for us with HIV, and we need to reach this within the next 5 months, and we're working very hard at it, and that's why I'm so deeply honored that Nomzamo has agreed to come on the program tonight to highlight some of her own experiences in this regards.
And Nomzamo, talk to us about some of those experiences. I know that you supported charity because of having to help take care of orphaned young children when you were young due to HIV/AIDS.
I mean, this is a story that I've spoken about quite not as frequently as I think I should, in terms of just my upbringing. When I was growing up, we had one of our relatives who passed away, and my grandmother was the only person, or I guess, only person who in the family was able to house the two children. One was 8 and the other was at 7.5 months. Their mother had just passed away, and I was a young teenage girl at the time. And because my grandmother was old, she couldn't do a lot of the things, which meant that the young child, who was 7.5 months, who had contracted the disease from her mother through breastfeeding, was then my responsibility, from getting her a birth certificate to taking her to her monthly visits. So when it comes to ARV training, I went through it all. I would sit in the little offices at Sniggy Temba, which is a health center that McCord Hospital in Durban had, and that was my life. My teachers at school would understand that every month Nomzamo has to come with her little cousin, and she has to take the little cousin to the doctor's visits. She went from being a sickly child who was literally on death's door. At the age of 10, the virus was non-detectable in her blood. Right? Because the viral load was so low. She's still alive. She is 21, and it is a miracle. So for me, the reason why I would, when Lana grabbed my ear about what's happening right now in terms of USAIDs, for me, I've seen what it does in terms of transforming people's lives and giving people a second chance, to say that it is not a death sentence, that there is an avenue. You can be able to live a life. And back then, I mean, ARVs were 8 pills a day. So you can imagine for a little girl who had to take 8 pills at 7 a.m. in the morning and another 8 at 7 p.m. because of the time, right?
Now, allow me to just interrupt you and ask you this question. And I'd like to juxtapose what you've said before, that you would like to, really change the narrative around South Africa being associated with HIV, AIDS and poverty, which is important because we're not seen as anything other than that in some quarters. So how do you do that with juxtaposed with the great work that you do as an actress, as a model, without, belittling it, making the story heard, making sure people understand the challenges, but at the same time driving home the emergency of our situation?
That's a great question. I think for me, it's constantly about dismantling what the world views South Africa as. And it is not a people that is destitute. It is not a disease-ridden people. And I would probably even say that it's not even just about South Africa. It's the African continent at large. So it's important for us those who are in the country, those who are, the daughters and the sons of the soil, to be able to dismantle that narrative and portray a different narrative. I think it's not even just public figures thing. It's even about the media. I'm sure you can definitely attest to the fact that the responsibility that you have in breaking down stigmas when it comes to portraying people of this nation in a positive light and in a light that is overcoming and in a light that is of economic assets.
Ambassador, let me come to you just on that point. Health reporting, as Nomzamo points out, is a challenge, and often because it's not necessarily good news stories. And even on your side, even as much as you give aid, there aren't always good news stories to tell, because the demands on the partnerships that you have and the partnerships that you would like to have can be very tricky. So what would you like now to further illuminate the situation, especially when it comes to issues such as access, such as prevention, treatment services?
Yes. Thank you for asking me this important question. We need to remove the stigma. We need to take away the stigma completely. And I think Minister McKee's has been very helpful recently, because we're now permitted to give 6-month dispensing. And the most important thing now for us to get epidemic control over the next 5 months is for people to stay on their medication. Don't stop. You have to stay on your medication. Please go to the clinic, go to the center where you get your medication, or we'll even bring it to you. We have 16,900 healthcare workers that we support in South Africa with PEPFAR and with the entire program, and we'll bring your medication to you. It is absolutely crucial and essential at this stage. And I think by Minister McKee agreeing to a 6-month dispensing, I think it's easier for people to now stay on their medication. But please don't lose sight of that. And if every person who's listening to this program tonight mentions to 6 people they know, either who have HIV or who need to be tested for HIV, to please have them take their medication or come and be tested now. We have all this. We can reach epidemic control in 6 months. It's absolutely key. It's so important for us. And let's take away the stigma.
Nomzamo, I'll get your point of view on this in just a moment. But Ambassador, family planning is one of the major hurdles that we face in South Africa in attainment of this goal. And sometimes there's a clash in terms of policy approaches as well, South Africa, US. So what would you like to say with regards to that, where we can find synergy and find better cooperation to encourage young people to take up these services?
Well, we have this incredible Dreams program where we have Young Dreams ambassadors reaching out to young people in the community. And there's been a tremendous success rate with that, even in the last few months, even with COVID. And I would say the synergy is absolutely top class at the moment between South Africa and the United States in this program. We're agreeing on everything. We're working together, the minister, the deputy minister, the new DG, Dr. Buthelezi, and our health team here on the ground in South Africa in our very, very extensive program. So the synergy is absolutely top class. Now it's to South Africans to please help us and be responsive. And when you hear somebody like our lady who's going to be part of American pop culture very shortly, and we're going to claim her as part of American pop culture as a South African movie star, Nomzamo. You're hearing from her own example how she's been touched. I'm sure there's everybody in this community who's been touched, and we have the two unparalleled CDC, Centers for Disease Control, which is unparalleled in the world, and then USAID, both very, very involved in the PEPFAR program, and extraordinary.
So, Namsama, how are you going to, through your own experience, as you said, you've garnered quite a lot of knowledge because of this personal experience, but sometimes people are ambivalent about you spreading the message. I mean, I remember somebody saying, are you HIV positive? So those kind of questions that want to put it in your backyard in that way, how are you going to do that and spreading the message of awareness around HIV/AIDS so that there is an ambivalence, so that people take ownership of their circumstances as well?
I mean, when it comes to that, I think we definitely have crossed that hurdle before, because as a teenager, going with a young girl, with a young baby, walking into that youth center, and there was a school across the youth center, I've always had that in the back of my mind, that whoever sees me walking in there, or even if you're sitting there and there's everybody who's in there waiting to see a doctor, it's already understood that you're HIV positive. So for me, I've always wanted to say, take away the stigma of being HIV positive. What does that mean? You look at how the COVID pandemic has impacted stigma around viruses. You know, people aren't shy to say I tested positive. Ask yourself why they're shy to say I tested positive for HIV and AIDS. So it goes back to Ambassador Lana's remarks about destigmatizing. It's so incredibly important to do that. And I just wanted to add on the family planning that, you know, sexual education is crucial. Sexual education, for me, I feel like is still one of those departments that's still not been perfected. And for as long as the Department of Health does not perfect that, we will still be able to experience what we're experiencing now when it comes to disease and when it comes to sexual health.
Thank you so much to you both. Nomzamo Mbatha, PEPFAR, collaborating with prominent South Africans as her U.S. Ambassador to South Africa, Lana Marks, in collaboration with these initiatives and these well-known South Africans to talk about that, to push the agenda of not only combating HIV/AIDS, but making sure that while we're doing so amidst COVID-19, that the gains that have been made over the past few years are not lost. And just to tell you the latest numbers with